You might think you know your cat pretty well, but have you ever considered that she could be asking for help without you noticing? Unlike us, she won't scream or make a fuss when she's in pain. In fact, the changes are often very subtle, and only someone who knows her well will spot them. Most owners miss when their cat starts hiding discomfort because they have a strong instinct for self-preservation. But there are small signs that could be a silent cry for help. Is your cat trying to tell you something? In this article, we'll reveal the signs you need to look out for to understand when your cat is asking for help. Ready to discover what she's trying to say? Cats, by nature, are masters of hiding pain. This instinct stems from the wild, where showing weakness could make them prey. In domestic settings, this behavior persists, making it harder for owners to spot when their cat is suffering. This instinct to hide discomfort is often why cats seem to avoid showing signs of illness. A cat might retreat to a quiet spot, acting distant or reclusive. These subtle changes in behavior should raise a red flag for any attentive owner. As much as it may be frustrating not to know exactly when a cat is in pain, it's important to recognize these signs. If a normally sociable cat suddenly becomes withdrawn or hides more than usual, it may be time to investigate further. Sometimes it's a quiet cry for help disguised in instinctive behavior. When a cat starts hiding in unusual spots or avoiding contact with people, it's often a signal that something is wrong. A cat that retreats to a dark corner or under the bed, away from its usual spots, might be dealing with discomfort. Cats, who are usually curious and sociable, can become reclusive when they're not feeling their best. If the hiding becomes persistent, it's crucial to pay attention. Cats don't just seek out new hiding places for fun, they do it to feel safe. For example, if a cat that usually enjoys interacting with family members starts isolating itself, it's an important clue that shouldn't be ignored. This could indicate that your cat is trying to protect itself from something, whether physical or emotional. This behavior is not limited to just physical pain. It could also be a response to stress or anxiety, which sometimes stems from changes in the household or environment. You might notice a cat that once roamed freely, starting to avoid favorite spots like the window or its usual nap corner. Such behavioral shifts, though subtle, are signs that the cat may need attention and care. A cat that begins avoiding its litter box or urinating outside of it can be a clear indicator of health problems. Urinary infections, kidney issues, or bladder stones are common culprits behind this behavior. It's important to remember that cats are usually very clean animals, so when they stop using their litter box, it's usually due to discomfort or pain. If your cat suddenly starts urinating outside the box or seems to have trouble in the box, don't dismiss it as behavioral. Sometimes, even the slightest changes in their urination habits can signal a bigger health issue. For instance, frequent trips to the box with little result could be a sign of a urinary tract infection, which requires immediate veterinary attention. Pay close attention to the litter box habits of your cat. If you notice blood in the urine, increased frequency, or signs of straining, it's time to consult a vet. Cats often go to great lengths to hide their discomfort, so any change in litter box behavior is something you shouldn't ignore. Cats are known for their meticulous grooming habits. When they suddenly stop grooming themselves, it can be a red flag that something isn't right. A cat that normally spends hours grooming its fur might start looking unkempt, which could be a sign of arthritis, dental pain, or even an internal issue that's affecting its comfort. If a cat that once prided itself on its neat appearance begins to neglect its grooming, take note. A lack of grooming can indicate physical discomfort, especially if the cat's mobility is limited due to pain. In such cases, even reaching certain areas of the body may become too painful, which can lead to a noticeable decline in grooming. Sometimes, grooming issues are more than just a physical sign. They can also be emotional. Stress and anxiety can cause a cat to stop grooming, and that can be linked to changes in the environment or routine. It's important to assess both the physical and emotional well-being of your cat to get to the root of the issue. Bad breath in cats is often overlooked, but it can be a sign of serious health issues. While a cat's breath might not always smell fresh, a noticeably foul odor could indicate dental problems such as gum disease or tooth decay. If left untreated, these conditions can worsen and affect the cat's overall health, leading to more severe issues like infection. When a cat's breath takes on a particularly unpleasant odor, it's important to investigate further. Bad breath can be a sign of bacteria buildup in the mouth or other systemic health concerns. For example, an infection in the teeth or gums can spread, leading to pain, difficulty eating, and even affecting vital organs like the heart. If you notice persistent bad breath in your cat, it's time to schedule a vet visit. Regular dental care, like professional cleanings, can prevent most of these issues. And while it's easy to overlook, this is a small but significant way to ensure your cat's long-term health. Aggression in cats is usually a response to pain or discomfort. A normally friendly cat that suddenly becomes aggressive, especially when touched in specific areas, might be trying to communicate that something is wrong. This change in behavior is often a sign that the cat is in pain and feels threatened when someone tries to touch the painful area. It's important to recognize that a cat's aggression is often a defense mechanism. They're not attacking because they're angry or bad-tempered. They're reacting to discomfort. For example, if a cat that usually enjoys belly rubs starts hissing or swatting when you attempt to touch its stomach, it could be a sign of abdominal pain, perhaps from an injury or gastrointestinal issue. If aggression is coupled with other signs of illness, such as changes in appetite or hiding behavior, it becomes even more urgent to seek veterinary attention. A cat's sudden aggression should never be dismissed as mere moodiness. It's often an indication that something is seriously wrong. A sudden loss of appetite in cats can be a sign of serious illness. Cats are usually quite consistent with their eating habits, so when they suddenly stop eating, it's important to pay attention. This could be linked to a variety of health issues, from infections to more severe conditions like cancer or kidney disease. If your cat stops eating for more than a day or two, it's essential to investigate the cause. In some cases, a cat might stop eating because it's in pain. Dental problems, gastrointestinal discomfort, or even stress can all interfere with their desire to eat. If the problem persists, a visit to the vet is necessary to rule out any underlying conditions. In addition to health problems, stress can also play a big role in appetite changes. Changes in the home environment or routine can cause a cat to lose interest in food. If you're noticing this along with other behavioral changes, it's time to take action and get your cat the help it needs. When a cat suddenly starts eating more than usual, it can be a sign of an underlying health issue. Increased appetite, known as polyphagia, is often linked to conditions like diabetes, hyperthyroidism, or even parasites. It's crucial to monitor your cat's eating habits and consult a vet if the increase is persistent and unexplained. If your cat is eating more but losing weight, it could point to a metabolic issue, such as diabetes. On the other hand, if the cat is eating excessively and gaining weight, it could be a sign of thyroid problems or even a food-related issue. These changes, while subtle, can signal something far more serious than just a bigger appetite. In some cases, an increase in hunger may be tied to stress or boredom. If a cat isn't mentally stimulated or isn't getting enough physical activity, it might overeat to compensate. However, if the cause seems medical rather than behavioral, it's best to have your cat examined by a vet to rule out health concerns. Sudden weight changes in cats, whether it's a significant loss or gain, are often a sign of underlying health issues. Weight loss can be caused by metabolic disorders, digestive problems, or even parasites. On the other hand, unexplained weight gain might indicate conditions like hypothyroidism, diabetes, or overeating. If you notice your cat losing weight rapidly, it's important to take action. Conditions like chronic kidney disease or diabetes can lead to weight loss despite a cat still eating regularly. Conversely, sudden weight gain without a change in diet could indicate that something else is affecting your cat's metabolism, like thyroid problems or an issue with its organs. Regardless of the direction of the change, monitoring your cat's weight is essential. Consistent weight loss or gain can have serious long-term effects on their health. Regular vet visits and a healthy, balanced diet will help ensure that your cat maintains a proper weight and avoids health complications. If your cat seems to be drinking MO, excessive thirst in cats, also known as polydipsia, can be a symptom of several health issues, most commonly diabetes or kidney disease. If your cat is drinking large amounts of water regularly, it's essential to take this seriously. While cats can naturally drink more water in hot weather or after eating dry food, an increase in thirst without these triggers should raise concern. If your cat seems to be drinking more than usual and urinating more frequently, it could be a sign of diabetes. On the other hand, kidney problems often result in increased thirst as well, as the kidneys struggle to retain fluid. In either case, this behavior should not be ignored, as both conditions can lead to serious complications if left untreated. To address excessive thirst, a veterinarian will need to perform tests to determine the root cause. Early diagnosis and treatment are key to managing these conditions and preventing further damage to your cat's health. Keep a close eye on your cat's water intake and seek professional care if you notice any significant changes.